AI is nothing but it's machine learning. The different parts of it, where if you feed a lot of data into it, if I talk about the patient characteristics, if we talk about surgical videos, if we talk about the general demographics of a patient, the AI probably and may also help us in detecting the problems and guiding us to prevent complications and also to diagnose cancers. It's so common now. It's a little more than normal. When we ask a couple of questions and then I feed it up into AI, say I take about 1,000 patients and I feed all this data, I have a company who does the AI, and then this will give me predictive models that this patient probably will have a fibroid and this patient may not have a fibroid, with the history and with my ultrasound diagnosis and whatever I feed into the AI.
So, do you feel sometimes like AI also can be dangerous kind of
Oh
thing
yes,
or
it
not?
can.
AI isn't just about the emails, chatbots anymore. It's actively moving into the diagnostics, operation theater, and surgical platform. As AI moves from the screen onto the prescription pad and surgical maps of the top specialists, we have to now look from a bigger perspective. Where does this technology end and where does this human touch begin? In today's episode of the Healing Art with Surya, today we are going to deep dive into the fascinating world of this AI in the gynecological surgery. Joining us today is an expert gynecological surgeon. She will help us to understand the real impact of AI in modern healthcare. She is an absolute forefront to integrating the technology into the operation theatre to make the surgery more faster and, most important, the patient care more precise. So stay with us till the end because this conversation might change your thinking, the way you think about the artificial intelligence or the modern healthcare in the future. Dr. Tanvi, thank you so much for joining us today.
Thank you for inviting me for this podcast.
Thank you, ma'am. Thank you. It's my pleasure.
Yeah.
So today's topic, as we know, it's about the AI.
Yeah.
So people often think AI means like how they see in the movies. It's all
Yes.
futuristic and everything. So in the real world, if we talk about the AI, how it looks like.
Yeah. So you specifically mean in the medical field, right?
Yes.
So be it in medical field or as far as I understand the AI, because now it is the need and it is the future, and it is data based. So it's not going to replace humans, but it is definitely going to help us. It's like an addition to the work that we do in our workplace. So if you talk specifically for the medical field, yes, AI is the future to help us do our job better, but definitely it cannot replace the doctors. Yeah.
Okay. So how? We can explain people.
Yes. So AI is nothing but it's machine learning. The different parts of it, where if you feed a lot of data into it, if I talk about the patient characteristics, if we talk about surgical videos, if we talk about the general demographics of a patient, if we talk about the post-operative follow-up, and we feed in lot of information, lots and lots of data, a high quality data. If we feed in, and then the machine, there is a whole process of it where it does a lot of deep learning, and that's how AI, out of this data, just like we have our evidence over a period of years and years that we study and we do a lot of publications. Say we have 1,000 cases. To just give you an example, if we have about 1,000 cases and if we have one injury, how do we detect that injury? How do we prevent that injury? So the AI probably and may also help us in detecting the problems and guiding us to prevent complications and also to diagnose cancers. It's so common now, so much on a rise, right? So with so much of data that we fill in, sometimes they're very obese patients, very fat patients who don't get cancers. but very thin, very good lifestyle, probably have cancer. So with AI, the detection can be much earlier, much faster because of the data that we feed in. So that is something we have to remember. So that is for a general public. I hope I've answered the question.
Yes, data in the sense there is some confusion. Like when a patient comes for a checkup, that time whatever the data we feed in to the system, based on that the AI will detect, or how?
It depends on what you're looking for. Like, when women come in, because I'm a gynecologist, I only treat or I look after the women. So for us, it's very important that we inform the women what we are doing. So we do take a consent because I'm into research and we do a lot of publications, and hence we take a consent as they come in to our clinical OPD that whatever data we take in will be anonymous and will be used to further the research for betterment of the clinical practice. So this data we take in. Example, I give you, say, fibroids, a simple thing in a gynecological practice. A woman has heavy periods every month. It's a little more than normal. When we ask a couple of questions and then I feed it up into AI, say I take about 1,000 patients and I feed all this data. I have a company who does the AI work. I have to do it with somebody else because I cannot do it myself. Right. So I will be taking help of another third-party company who does the AI integrative programs. Right. And then this will give me predictive models that this patient probably will have a fibroid and this patient may not have a fibroid. With the history and with my ultrasound diagnosis and whatever I feed in to the AI. So, and also with the cancer risk. If I talk about the BMI, I feed in a lot of data and I feed in a lot of characteristics. So if I put in properly, then they can give me a lot of predictive models of prediction that this patient, probably this woman will develop a breast cancer in the next 5 years or probably in the next 10 years. So that is how I can take corrective actions at a very early stage. So this is what I mean by data. When I take a history, it's very simple. Whatever I ask, simple questions that I ask, I write into my files and then I feed it to the AI.
I think I answered my next question. What I supposed to, like, how does having an AI assisted like anatomy of human and based on that imaging, how does it help? I mean,
okay, so you're talking about anatomy, as in you're talking specifically
AI
about the surgical?
So
during the surgical. So there are two things in this. Okay, it can be preoperative. That is, if a woman comes with a certain complaint and we need to treat them with infertility, example, endometriosis, so common nowadays, or even fibroids, because fibroid is a big field where we are using a lot of AI in our own practice to diagnose and map a lot of fibroids. So that helps us in precision. So we know which are the fibroids to be taken out. Sometimes there are multiple fibroids. So AI models assist us, but they're not conclusive. So the surgeon cannot lose their clinical acumen. It is very important that the surgeon or the doctor has to have their clinical acumen. So you have to treat AI as one of the subjects. Just like you do your biochemistry, you do your medicine, you do your training in obstetric gynecology, AI is also one of the subjects. It cannot replace a doctor. It cannot replace humans. It has to be treated. It has to assist us. So we use it in assistance. And example, a lot of surgeries that we perform, and how AI really helps if you're doing intraoperatively. It will help us in telling, okay, you're going wrong. You're going very close to a structure where you're not supposed to go, which could probably cause an injury to the woman in long term. She may have a problem. If I go close to the nerves, sometimes they have permanent damages.
Correct.
So the AI, if you feed good data, so remember, again, I stress on it, if the AI is properly fed with high quality data, it gives us very good input. So to direct me, don't go here, be careful, be careful. So that's a warning. So I know, okay, I don't go at this place, but I know how much to go and where to take out.
Right. Yes. So it reduces the human error.
Absolutely. It helps in reducing the human error.
So does it take time? I mean, based on each patient wise, we have to feed in the data, or it's like overall, these are the common symptoms, like a patient comes and these are the data, so AI will automatically detect those things.
So AI is not just about my data or one person. So this is basically, FDA, the US FDA has approved certain applications of AI, which are within the ethics. So that's also very important, because it's important to understand that ethics are important, and AI can probably cross that limit or boundary. So they are already made. All you have to do is integrate in your system. So if I put in information, if my system is AI generated or AI backed, I put in information of the patient. So it gives me an AI result of probably this woman may have a risk. Probably this woman has this. Then I'm more careful as to how I go about it. It's not like I feed in every information. It's already done. Yeah, and there are more models coming up, especially in obstetric-gynec. I think a lot of work has been done in cancers specifically. They're trying to do a lot in breast cancer, in lung cancer, all of these areas. But obstetric-gynec, it's also being done for endometriosis, for menopause, for cervical cancer screening, so that we reduce the rate of cancer cervix. And so these are the areas where the work is being done, but I think there is still a lot more to do. Yeah.
So, do you feel sometimes like AI also can be dangerous kind of?
Oh yes, it can be. Like I said, again and again, I think if we have incomplete data, if the companies that you are associated with, they don't understand, because there can be some companies who are money making, they have half knowledge and they rush into, the AI companies that we talk about, and they're not properly certified. You just go and give whatever data, and they come to you and say, okay, you can use this in your software, you can integrate in the software. It can overdiagnose patients, it can overdiagnose problems, it can give you wrong reports. So sometimes you may tell a patient which they don't have. So that can be a bit of a problem. So yes, AI can be dangerous if it's not used judiciously. So that's why, to reinforce, it's very important to understand that AI will not replace doctors. So it's more of a talk between doctor using AI and doctor not using AI. So if the doctor who doesn't use AI in today's time may not survive as well as a doctor who's using AI, because it definitely adds value to your work, it reduces your stress, it helps you pick up complications better and reduce the complications rate by probably, as of today, 30%.
So AI also helps in treating the infertility things.
It's all, yes. It how it does is predictive models. Like, there is a lot of work being done in endometriosis and in diagnosis of PCO. So this is where the predictive models come in, as it gives you a percentage of what is the risk of this person having, infertility because of this, because there's a lot of gray area in infertility. And in endometriosis also, for surgical planning, it does help. So basically, male factor, female factor, how is the embryo, whether the quality of the embryo is good to implant. So what is the success rate? If this embryo is good enough, to transfer into a female so that she conceives. So this way, AI can help a lot in improving the fertility or the reproductive outcomes in an infertile woman.
Okay. Now coming to the surgery things.
Yeah.
Like when we talk about the robotic and AI, like it's two different things, or robotic has the AI integration?
Now it does. Before, obviously, it did not. Robotic is not AI. Remember, robot is a system like the Da Vinci being the most common, and now a lot of other systems have come because the patency is gone. So, but now when we talk about Da Vinci, the latest model which has come in, the 5, has an AI integration. So until now, robot, the only problem with robot as of now were two things. Ergonomically, it was a little difficult for the surgeon because they had to really bend forward with the systems that are available today. And the other thing is, you don't get a tissue feedback very well. So you would not get it as if before. But with AI integration, I think this is what has changed. I don't know if it's there in the Indian market, but the latest model of robot of Da Vinci 5, which is coming, it gives you a tissue sense. which is very common. When you do an open surgery, you feel the tissue.
So it has the tactile.
Yes, it has a tactile sensation which it did not have before.
Okay.
So that is what AI has helped the latest robot to come in. So I think that is a newer advancement and it's excellent. I think robotic is the future, but I won't say laparoscopy is out. I have to add that over there.
Right. And they are also coming, I think, with the multi-port system, so that
it helps in improving the clinical outcomes and lesser incisions. Absolutely. Yes.
So integrating the AI, does it help for the faster surgery process? Or
absolutely. Absolutely. Because it guides you better. Like example, if I talk about laparoscopic surgery, and it helps us to understand endometriosis. If I have an AI model there right in front of me when I'm doing my laparoscopic surgery, and I know, okay, this is where I go, okay, this is where the nodule is, I don't have to hunt. As of now, what we do is we do an ultrasound, we are sure it could be here, and we go very slow, we take a little more time, we dissect the structures. But if you're very sure this is where it is, there's a lot of mental planning. So it helps in precision, it reduces the time. So yes, it helps in better patient outcomes. Absolutely.
But a few of the patients, they're not still, I mean, since it's an advanced technology, anything new comes in the market, it takes time to adapt.
Absolutely.
So people come like, what it stops them to go for the advancement? They think like they comes because of maybe your name, that you are there, you'll be doing the surgery, and when they hear that the robot is going to do surgery.
Now that is very important to inform or counsel or talk to them. See, when you tell a patient a robotic surgery is going to happen, they have this in mind with Instagram and with all the videos that go around on WhatsApp videos saying, in China, a lot of hotels have this robot getting in food or, doing all this crazy stuff, which is really good, which is very good. But a robotic surgery doesn't mean a robot doing a surgery. So let me give you an example. I myself being a surgeon, a gynecologist, my aunt recently underwent a knee surgery.
Okay.
And in my mind, they asked me, being a doctor in the family, obviously they asked me, I've been advised to go for a robotic surgery and not for the regular, open knee replacement. And I'm like, how can they do a robotic knee replacement? You hear about robotic, but you just try to think in your mind and try to assess, because as a laparoscopic surgeon, I don't open up the abdomen. I put in small holes and then I see what's inside. But here, and I said, no, you don't need, there's no difference. It's just the money. They're going to charge you a bomb and just go for an open surgery. But then she's smart, so she did more research.
Okay.
And she came and told me, I think I want to go for a robotic surgery. I said, if you want to go for a robot, but I want you to be there in the theatre. I want you to be around, just ask the surgeon. And we know the surgeon, and he said, okay, not a problem. I was very curious, what is the difference? So, I think this is where the difference comes in. Because when I went into the theatre, I was very impressed how the robot actually helps with precision. So in a robotic surgery, it is not the robot operating. Again, very important. It is the surgeon operating. It is an open surgery, which is done as any knee replacement. The only difference was it is robot assisted. So robot gives you precision. So there was the marking. It was the marking which the surgeon did as to how much with an error of less than 0.5.
Okay.
When there is an error of less than 0.5, so the chances of, my aunt having better recovery, faster recovery is much higher. And I could see that because recently we went to an outstation and she operated last month. She got operated last month.
Okay.
And this time she could actually climb up a mountain within a month with her such precision surgery and good recovery. So this is where I think the robot helped in cutting just what is needed. If it is not, if it cuts more than what is needed, which can happen in a human error, there is a chance that she would limp.
Correct.
She would not walk properly straight in a line. So this is the difference where robot gives you better clinical outcome and it changes the quality of life.
Correct.
So that is your answer.
Yes.
So robot doesn't mean robot. AI, this is where the AI actually helped. So again, it can also help in laparoscopy the same way.
Okay.
Yeah.
So I have answered my two second question as well. Like,
Okay.
does AI helps in fast recovery? Like as you mentioned,
Absolutely. Yes, it does.
so fast.
So, yes, it does. It definitely does. Even in laparoscopic surgery, it does. Like in hysteroscopy, I'll give you, before you go to the next one, there is something called a septum. Now, there is a newer technology which has come in where, if you overcorrect the septum, you thin out the uterus. So, the chances of the woman, after she gets pregnant, going for a rupture of the uterus is much higher if you thin out too much. If you undercorrect a lot, then again she may land up having recurrent abortions or again being infertile. How it helps in infertility. Right. So cutting it right matters. So there are some people I know in Europe who are actually using or developing the AI technology where it gives you a warning intraoperatively that this is where you stop when the septum is done. So you don't go beyond that limit. Right. So that is how AI really helps in infertility again.
So when the robots and AI comes, like how the patient takes time to adapt things.
Yes.
How about the surgeon? So when it comes for them also, it is completely new.
You mean the AI or the robot?
AI and the robot. Like nowadays the AI integrated robots are coming. That's a different thing. But if we talk about the robots also.
Yes.
So anything new, you have to adapt and directly they do.
So I think laparoscopic surgery has a longer learning curve.
Okay.
And robotic surgery with the way it moves around is more like an open surgery. So there is a learning curve, but much shorter.
Okay.
And whichever robot you're opting for, usually they do give training. So you have to undergo training with them, which is not for a very long time, probably 6 months to a year.
Okay.
And then you have somebody to mentor you for a couple of cases. That is a requirement when you're doing a robotic surgery.
Right.
About I think 10-20 cases. I'm not too sure because I'm a laparoscopic surgeon. But I do understand that once they're mentored, they're ready to go. Now the difference that happens it's very easy to adapt. Once you learn it, it's easy. And there's a lot of support in robotic surgery. So it started off on a right note from the day one. Okay. Because the company supported training. Whereas in laparoscopic surgery, that's where we lack, because I think that's where the problem comes in. The training is a problem. The training has a longer learning curve. So then it requires more skill compared to robotic surgery, from my understanding. Yeah.
Right. So I
hope I'm answering your questions, right?
Absolutely. So my one more question. Where do you see AI having a biggest immediate impact on the reducing the risk factor?
As in the complications, you mean? Yes. One is preoperatively the precision. So if I'm prepared that I have which type of fibroid, where is the fibroid in cases of fibroids, and if I know this woman has a septum, how much I want to cut, if the AI helps me with that, I know I'm doing a right job, but I have to feed it. The third thing would be endometriosis. If I know I don't have bowel endometriosis, if I know what is the level of adhesions inside the uterus, I know where to go, where not to go. If I'm mentally prepared, I do a better job. I do a faster job. So I have a faster recovery in the patient, for sure, and less blood loss, less adhesions. So many advantages of that, because I go prepared in my mind that this is where I'm going to go, this is what I'm going to do. And if the AI have intraoperatively assists me in avoiding complications, so definitely yes, it is going to decrease my complication rates by about 30%, because I use a lot of AI in fibroid mapping as of today. What we have is a technology where I can map my fibroids by AI. Okay. And especially in infertility patients, sometimes in multiple, and that's something that we are working on, a paper that we are working on. And I know, because there was one case where I did, and there was this infertility doctor. I did a hysteroscopy. I said, she's okay, go back to your doctor and she'll go ahead with the treatment. And the doctor was not happy. She said, no, I find something abnormal in some area. She's had 2 failures, IVF failures. Please do something, treat her.
Okay.
You have to take this fibroid out. I'm not sure where it is, but I know it is there at a certain point. So then I was like, okay, and then I did a little more detailed scan, and then I used my AI technology in my ultrasound to map my fibroid. And then we were able to remove it, and she got pregnant, and now she's about to deliver. So I think this is where it helps in improving the patient outcomes. But a note to add on to this, it requires a clinical acumen. You can't totally depend as of today on AI. That's something we cannot leave it to AI. Yeah, it assists us, it helps us and assist the doctors in our profession. Yeah.
But we can say the future is AI and
Absolutely, yes.
Yeah.
But it is not replaceable. It is not going to replace
It will never
human. No,
replace.
not replace doctors. Because it doesn't have empathy.
Yeah.
It cannot talk to the patient.
Correct.
It cannot discuss with the patient. You can use AI to counsel the patients, and that helps a lot in practice.
Right.
But definitely, it cannot replace the human touch. Yes.
So in laparoscopic surgery, AI is till now not
I think there are
much.
certain centers who are using, just
Okay.
as in the robotic surgery, because laparoscopy has a better tactile feeling, and it depends on the surgeon over here a lot.
Okay.
Who's the surgeon? Also in robotic, I would say to a great extent, even if you have the best of robots, if you don't have a good surgeon, then the surgery is not great. You know, with all the AI technology you have, it might get a little helpful to them, but still the surgeon matters. So AI is being used in certain places for even laparoscopic surgery, just like I told you, to prevent complications intraoperatively, especially the ureter, because that is what we commonly face, or even the bladder, how far to go, where to stop. You know, these are the things that it is being used for definitely around the world. We are not using it in India, as far as I know, complete AI technology. Yeah.
So does it also helps to reduce the pain of the patient?
No.
Because in traditional method and robotic method, that is different.
Yes.
That is different. But
Yes.
when it integrates with the AI, is it something like it
Well,
also
I
helps
would
to
say
reduce?
no, indirectly no. It depends on the patient profile. But I think indirectly, if the planning is good, the precision is better, the surgery is faster, then probably yes. In that way, it may help certain group of patients depending on what they have. It may help to reduce the post-operative pain a little better than what maybe, you know, it depends on the patient profile a lot. Yeah, what kind of cases we are dealing with. Yes.
So is it also pocket friendly or it's expensive?
Not at all. I think it's extremely expensive because I was just seeing the cost of the robot, which I told you, the AI assisted robot, which was how much, about 3 to 4 million, which I don't know how, when you convert in Indian rupees, how much it's going to cost, but I think it's a little too much and it's not pocket friendly as of today. But there are some Indian, I think we do have a lot of other robots which are pretty good. But still, we are still not there. Though we are definitely faster growing as far as the AI technology and robotic technology is concerned in India. But I think there's still pockets where it's difficult for the patients to, you know, have.
So especially what kind of cases you suggest them to go with the robotic?
I think for robotic, I would say in infertility, if you're asking, I would say isthmocele repairs, because the suturing, I think, is where I struggle with in laparoscopic surgery, because it requires a different angulation, and laparoscopic does not have a 360-degree turning around just like the, you know, robot has. So that is the only place where I felt probably robot is superior in gynecological surgery. If you talk about endometriosis or radiations or any of this, I don't see robot to be very superior to laparoscopy, because with the 3D, 4K, with the ICG that we have today, I think we have an excellent view of the whole pelvis, and we are able to do literally everything, because I've sat on the robot, I've seen how it looks. It literally is the same view. So that I don't think has, it depends on the surgeon, how good the surgeon is to do the surgery. It may only help the surgeon to be probably slightly faster if he's already well versed with the laparoscopy.
Okay.
Yes.
But in case the budget is a concern,
Then laparoscopic surgery,
so
definitely.
they have an idea.
Of course, that's all, and it's a very good alternative. In a In an experienced hand, laparoscopic surgery results are equivalent to robotic surgery, and many studies that have been performed between both, they have not found any difference in the patient outcomes between laparoscopic surgery and robotic surgery. It is a lot surgeon dependent. We have to understand that surgery, be it robotic or laparoscopy, it is the skill of the surgeon which the AI cannot replace. That has to be learned. That's why I say AI has to be treated as one of the subjects like you've had in your training.
Right.
It is not the main thing replacing us.
Just a helping.
Absolutely, absolutely. Yeah.
Now we'll talk about the myths.
Yes, sure.
So AI will replace surgeon, as you have already mentioned.
No.
So this was just a question.
Yes.
So people hear about the robotic assisted surgery and picture like pre-programmed machine making the independent cuts, like while the surgeon sits back and watches.
No.
Or the surgeon has to involve.
That's not a reality. No. Now there are also remote surgeries happening.
Okay.
That is, a surgeon performing from maybe, Pune to Hyderabad, or maybe from US to Hyderabad, from XYZ place to Hyderabad. Yes, it's possible because there is a technology which is advanced. There we are able to communicate in such a way that the robots have probably a Wi-Fi or a link that they're able to function here when the surgeon operates over there. But no, it is not independent of the surgeon as of today. No.
So AI is only for the big hospital, also for the small hospital?
Absolutely not. It is also for small hospitals. I work in a private small family-run hospital which has been there for more than 30 years. But and we have been using AI in our practice, and it has helped a lot in advancement. I think the only difference is it's easier for the bigger hospitals to get in, probably because of the money investments they have. But with now more availability of the AI, I think no, it is not restricted to only big hospitals. It can be adapted. Yes, yes.
So a glitch or power failure in between.
Yes.
So
that's why the surgeon's skill is always never be replaced. The surgeon's clinical acumen cannot be replaced. So start with your basics. Use the AI as you go around, but don't depend on the AI to do everything. Yes.
So AI cannot understand patients?
No. It can help you make the patient understand the problem that the woman or the patient has, but AI cannot understand the patient. AI can only tell what you feed them with the data that they have. So
right, exactly. Yeah. So AI makes surgery fully automatic?
What do you mean by fully automatic?
Like it's pre-programmed, like we know the problems and we have configured everything.
No. Every anatomy is different. I mean, every patient has a different build, different anatomy. There are women who have never had a surgery before, but inside there is a lot of scarring inside the abdominal cavity, and that is something which it can always be a surprise. So I think it's very, again, to reinforce, no, it cannot. It cannot be completely automated. It is surgeon dependent. Okay. It is surgeon dependent. It is the skill of the surgeon. AI is only to assist and help you plan better. That's all.
So AI is the only useful diagnostic?
Well, when you say diagnostic, are you saying, no, it is also for prediction. It is also for follow-up. It is also intraoperatively assisting us in places where we feel we're going wrong. Sometimes, because in India, I think many doctors are overworked. Sometimes we have number of cases. We work on Saturdays, which doesn't happen in many other countries. A lot of people, I know, a lot of doctors work on Sundays also. So with such tired minds, sometimes it is possible that you make mistakes, and that is where AI assists you, even intraoperatively. So no, I don't think it's only diagnostic. It may help you in deciding on the treatment, in the course of the management, and it does definitely it helps you administratively in a lot of ways. So no, it's not restricted to only diagnostic. No. Right now, probably in many places, yes. But the future, I think it's going to help in a lot of ways. Yeah.
Absolutely.
Yeah.
So that was my last question. So anything you would like to say from your end?
Yeah, I think as a surgeon, as a doctor, I think now we have so many good AI applications that are available. Like I use ChatGPT, I use Skyscape, Gemini sometimes, Claude probably at times, and Jenny AI. There's so many, and we have to advance with the times that we are in. We must be progressive in the way we go ahead, but never lose your basics. Make sure you learn your basic skills. Make sure you're prepared for surprises. Make sure you're prepared in a sudden change of plans and how to deal with them. That's where you can save lives, you can give better clinical outcomes. So, AI can never ever replace humans or the doctors. It is an adjuvant, it is an assistant to a doctor. So, it definitely use it wisely. That's what I would say.
Thank you.
Thank
Thank
you.
you so much, ma'am.
Thank you.
Thank you.